All right, Colton, thanks for meeting with me after our day today.
Yeah, no problem. Thank you for teaching me today.
Absolutely. Just a few things I want to give you a chance to reflect upon after our day. We had a 7 o'clock start. You arrived at 6:45, which is not early enough to get ready for a big case that we had.
Mhm.
We had a few things that we had to get ready, like a hotline and a line, assess the patient, check in with things. So I think you should probably arrive a little bit earlier in the future.
Yeah, in the future, I'll definitely start arriving earlier. We had a big test the other day, so it was hard to get out of bed, but no excuse. But I'll definitely start arriving
It's understandable.
earlier
Good.
to get set up for the cases, so my preceptors can rely on me getting stuff set up.
Good. I'm glad that you could see the importance of it. And it just benefits your learning. You'll get more out of the case getting here early and not rushing around.
Yeah. And then in the future, I'll know what to set up for those big cases as well. So.
Exactly. The other thing I wanted to talk about was the patient had an ANSEF allergy.
Okay.
You were getting ready to prepare, patient had a penicillin allergy. You were getting ready to prepare ANSEF, which there's a cross sensitivity between the two. There's a small chance, but it's still there. So we typically avoid ANSEF when there's a penicillin allergy.
Okay.
I want you to notice the importance of seeing the allergy on the patient's chart.
I think that goes back to me arriving late, feeling rushed. I didn't have a chance to look over the patient's chart. So in the future, I think arriving earlier will help me review the patient's chart more completely and
Exactly.
look at the allergies.
Exactly. I'm glad you see the importance of it. Good. And also another thing was that ties into the patient safety. I asked you to give 5 milligrams of ephedrine when the patient was hypotensive, which you did a great job recognizing the hypotensiveness and the need to intervene. But when I told you to give 5 milligrams, you gave 5 cc's, which is actually 25 milligrams.
Okay.
So I think in the future, a good practice would be displaying closed loop communication, where you repeat back to me or the surgeon or whoever's telling you to give something, repeat back what you're going to do and what you're going to give, and that way it eliminates the chance of having an error.
Okay, that makes sense.
Yeah.
I see the importance of using closed loop communication and how it improves safety, and I can give exactly what the surgeon wants or what you want. So.
Exactly. And that way everything stays safe and we treat only what's necessary. Yeah. And another thing I wanted to touch upon was the fact that we were doing a case in steep Trendelenburg, meaning what you saw, patient's head is very low to the ground, all the abdominal contents are pushing up on the airway, which causes the peak pressure to increase if you're using volume control.
Oh.
Yes.
Okay.
So you kept the patient on volume control, and the peak inspiratory pressures you realized were high. They were close to 40. So a better management strategy would be putting the patient on pressure control or pressure control volume guarantee, and that way you aren't risking barrel trauma to the patient with high inspiratory pressures.
Okay. I was wondering why the inspiratory pressures were so high.
Yeah,
So,
and that's why. And this is a good skill to develop now, so that you could set the ventilator ahead of time and anticipate things rather than having to react to things.
Okay.
And another thing that happened was the texting on the phone during the case. I realized a few times during the case you were texting. Now, if you have a personal emergency, that's totally understandable. We're all humans. But I would ask that you just tell me or tell whoever your preceptor is, and then you could step out of the room, handle what's happening, and then come back with your full attention to the patient.
Okay. Yeah. I was just texting my wife see what was for dinner, so I shouldn't have been doing that. It wasn't an emergency or anything, but next time, if there is an emergency,
Just
I'll let
tell
you
me.
know, and I won't be texting for personal reasons anymore.
Good. And if you're going to be using your phone to look something up, that's understandable too. Just tell me or tell your preceptor. That way they're not assuming that you're just goofing off on your phone.
Okay.
You know, it's okay to look things up, but as long as it's not pulling your attention away from the patient.
Okay. Patient should be number one.
Your priority. Yep. And another thing that happened during the case, towards the end, we're starting emergence. You did a great job by checking twitches. That's really important. patient had no twitches and you wanted to put the patient on pressure support, patient needs to be able to initiate a breath when they're on pressure support. If
And
they
they're
don't have,
still paralyzed with 0 twitches.
there you go, exactly. So if they don't have twitches, they're paralyzed, they can't initiate the breath. To follow up on that now, you were getting ready to give glyco and neo as a reversal, which is appropriate but not quite yet because the patient didn't have twitches.
Okay.
Do you understand or know how many twitches the patient needs to have before you could give glyco and neo?
I believe they need at least 1, but it's better if they have at least 2 twitches to reverse
Exactly.
with neo and glyco.
Exactly. Now, if you need to reverse in a certain circumstance and the patient has no twitches, do you know what medication we could use instead of neo and glyco?
Is it Sugamidex?
Perfect. Very good. Yep. So in the future, incorporate that into your practice, realizing that you're going to have to wait if you're using neo and glyco if the patient doesn't have twitches.
Okay. Yeah, I haven't used Sugamidex very much. I'm used to neo and glyco, so
Yep.
I want to start trying to use more Sugamidex.
Okay. Yeah, we could try to do that next time. But in these cases with neo and glyco, just make sure you got some twitches.
Okay.
Yeah, that way it could be effective.
Thank you.
Overall, though, I think you did a great job today. There were some little missteps, but you're new, and we're going to work on that. So to kind of summarize our day on things you can improve on, I think getting here earlier, which you already explained that you'll try your best to get here earlier. And I think you realize the importance of getting there earlier so you
Yeah.
can get the most out of the case.
Definitely. Especially being new.
Exactly.
Be here
It takes
earlier.
time to get prepared. And also the texting, just try to keep that to a minimum or not at all unless it's emergency. And like I said, just tell me if it's an emergency. And recognizing your vent settings for the appropriate surgeries, and the appropriateness of using glyco and neo in certain circumstances. Yeah. But overall, great job.
Thank you.
You got it, man.
Thank you. Look forward to working with you again.
Yes, me too.
Thank you.
Awesome.